मेरा नाम परवीन बानो है। मैं करीम नगर से हूँ। तो 2016 में मायलोमा आया था। मैं बहुत परेशान थी। उसके बाद 2016 से जो है एक साल तक मैं जैसे कीमो गोलियाँ दवाइयाँ खाते रही। इसके बाद जो है मैडम मेरा बोन मैरो ट्रांसप्लांट करे। उसके बाद जो है 4 साल टिका वो, 4 साल तक अच्छा रहा। उसके बाद जो है फिर पलट के मेरे को बीमारियाँ बोन मायलोमा आ गया, रिलैप्स हो गया। उसके बाद मैं फिर क्या करें मैडम, कीमो दिए वो दिए, नहीं टिका वो नहीं टिका, तो फिर दूसरा बोन मैरो ट्रांसप्लांट करे। उसके बाद मैडम क्या करें, बोले मैं जो मैडम बोले वो सुनती, इसलिए मैडम बहुत अच्छे हैं। उसके बाद जो है मेरे को मैडम क्या करे, कार्टी थेरेपी करने के बाद जो है मैं आज मेरा 2 साल हो गया। मैं जो है अब अच्छी हूँ, चल सकती, घर का काम काज भी कर लेती। अब 4 मंजिल ऊपर सीढ़ियाँ चढ़ के भी आई मैडम उन लोगों के साथ। और जो है आज मेरे 2 साल मुकम्मिल हो गए। मैं मैडम को धन्यवाद कहती हूँ।
Hi, I'm Dr. Padmaja Lokireddi. I'm a bone marrow transplant and cellular therapy consultant at Apollo Cancer Hospital, Hyderabad. It's my pleasure to talk about Parveen. Parveen has been very brave and has gone through 10 years journey now. Most of the myeloma patients, as we know, they're not curable. Parveen came to us in 2016. She had the first line of therapy with a VRD chemotherapy followed by first transplant. Unfortunately, she had a relapse of the disease 4 years after the transplant, and she had a second line of chemotherapy. During that time, as we used a daratumumab, and which didn't respond with a dara-based conditioning, so she went for a carfilzomib, pomalidomide, dex, also not responded. Then she need to have a high doses of chemotherapy, which is a very old traditional method called DT-PACE. She had 2 blocks of that. After that, her bone marrow disease went into remission, so we did a second bone marrow transplant. That was back in 2023. After that, she has been okay for about a year and a half, 2 years. Then the myeloma protein started increasing, and we have got no other options because she has now finished all the available options at that time. We had at that time CAR T-cell therapy for multiple myeloma as a part of the clinical trial, and we've enrolled Parveen into that trial. She was in fact our first patient to go in a myeloma CAR T trial. She's now 2 years after the CAR T. She has had an excellent response, ongoing remission, and she has got MRD negativity. As you know, for those patients with a penta-refractory, where you've exhausted all the options, your survival is limited in months. And we're very happy to see that ongoing remission is looking almost like a complete cure. And alongside, she has not had many side effects, and she's doing all her job. She's able to walk 4-5 flight of stairs. So I'm very proud. I'm very happy for Parveen, and without Apollo Hospital and part of this national trials, it wouldn't have been possible to keep all these going for Parveen. And as part of the trial, she'll be monitored now on a 6 monthly basis for close to total 5 years.